I'm David Levine. I'm co-chair of SWINY. I want to thank my co-chair, Joe Bonner, who is producing this and behind the scenes. Today, we're going to discuss what it's like to cover COVID-19 with perspective from 3 Latin American journalists. Unfortunately, one of our journalists had a family emergency, Will Monterosa, and he just let us know he can't make it. But anyways, I'm very happy to have Estrella Burgos and Ruiz, Myriam Vidal Valero, as well as Fabiola Torres. So I'm going to, rather than me reading your resumes, why don't you give a bit of introduction to yourself? Unmute yourself if you're not. I think you're all muted. And so, Estrella, why don't you begin and just say hello and say who you are and what you do.
Hi, hello everybody. Thank you so much for having me here. I'm very glad to be here in this panel with these 2 great women. I'm an editor of a science magazine for young adults and teenagers that we make at the National University of Mexico. I'm not a PIO. The magazine is intended for these young people and also the general public. And we've been out there for 22 years. It's a monthly magazine, and we cover all sorts of science topics, and we work with science journalists, science popularizers, researchers, and teachers. So, and I write myself too, but when you're an editor, there's not much time to do it. But I try.
Okay. Fabiola, go ahead.
Okay, thank you. I'm Fabiola Torres from Peru. I am a reporter. I am the director and founder of Salud Lupa. That means amplify glasses. And I think that we work like a network. It's a collaborative network focused on public health in Latin America. We are based in Lima, but we have coverage in the region. Before this experience, I worked in El Comercio newspaper 10 years, and one of my topics in my country, in Peru, was the inequality in the access of healthcare system and clinical trials and human rights.
Okay. Myriam?
Hi, everyone. I'm really happy to be sharing this panel with 2 beautiful ladies. I'm Myriam Vidal. I am a freelance science journalist based in Mexico City. I like to write about science in general, but over the years, I have been specializing in the coverage of environmental science and health science. Most of my pieces have been published in Medscape, but I have also worked for the New York Times, Science, and recently I wrote a piece for the Open Notebook about the effects of the pandemic on the science journalists here in Latin America. So I am also a member of the Mexican Network of Science Journalists and a lot of more things, but that pretty much sums it up.
Okay, well, thank you so much. I appreciate it. So in the countries in Mexico, there are 1.255 million cases and 114,000 deaths. In Peru, there are 986,130 cases and close to 37,000 deaths. And I was wondering what in your countries, who is leading the response effort, and how has it been to cover it? And is there any obstacles to it? So anyone can answer.
Well, I can start with that. I have to say I'm also a member of the Mexican network of science journalists. And well, in charge is the federal government, and we have a person, this man who is at our Ministry of Health. He's not the minister, but one step below the minister, and he's been handling the pandemic efforts, and not very well, I have to say, since we have a lot of cases and a lot of deaths. And, you know, but the policy is national on how to handle the pandemic. And there have been differences with Mexico City, with the largest city in the country, and many millions of people here. So our Mexico City now has a governor. It's considered a state in the country in recent times. And our government, she's a woman scientist, Claudia Sheinbaum, and she's following federal regulations, but she's doing more than that, I guess, because she's a scientist and she listens to science, which is not the same for our president, especially. So we've been having a lot of problems with that, and I'm sure Myriam can tell more on that. And yeah, go ahead, Myriam.
I think that the main problem here in Mexico is that the measures have been kind of relaxed. And in comparison with other countries where the lockdown was obligatory, here it has always been like a suggestion for people. Mm-hmm. And well, you have to take in account a lot of things, you know, the economical situation of Mexico. A lot of people work on informal jobs, so they have to go outside and work. But still, the response from Hugo López-Gatell, who is the Ministry of Health that Estrella was just mentioning, he has been criticized for not handling the situation well and not strong enough. So that has led to a lot of contagions here in Mexico. Actually, right now we are experiencing, I actually found it really funny. During the whole pandemic, I never received anything, but then like 2 days ago, last Friday, I received a text message in my cell phone from the government telling me finally to stay at home.
Okay.
So it has been kind of messy here. And I think it has been happening something similar in Peru, but I think Fabiola can explain more about the situation there.
Okay, so let me ask, I just want to follow up with a question. So have you had a mask mandate?
It's not suggested.
Suggested? Okay.
Yeah, they say you should, right? But it's not mandatory.
And what do people do?
They don't follow it.
They don't follow
well,
it.
Some follow or started to follow using masks, for instance. And, you know, there are regulations in every supermarket and in most, you know, places people go. You're not allowed in without a mask. You have to have something to clean up your hands. And they try to keep people more or less apart. But now with Christmas around the corner, it's chaos. You know, people are going out to buy presents and things. And especially in Mexico City, where there are many markets, it's really crowded. And the governor of the city, she's making desperate callings for people not to go out and to wear masks. But since it's not mandatory, not everybody follows.
Okay, and what's going on in Peru?
Well, in Peru, it was completely different because we were the first country in Latin America that have many restrictions since March. But as we say, is one of our conclusions is that we, since the beginning, we are fighting first century disease with 20th century healthcare system. We don't have the weapons to fight. This is our conclusion when we notice that even the strategics, the information, because we have a COVID force. At the beginning, it was joined with me for 10 people, and one of the doctors is now the Ministry of Health, Pilar Macetti. She was the leader of the COVID force and now is a minister. But what happened in Peru? We have a lot of inequality and access to the healthcare, and the country is different in the coast, the Andes, and the Amazon. We weren't prepared to have answers in the first months. And of course, we invest a lot of money, but the decisions were not according with the evidence. You know now a lot of information of the hydroxychloroquine and ivermectin scandal. Until now, the Minister of Health says that we have to use it because we invest a lot of money in there. It was something important, a critical lack of oxygen. It's incredible that our system couldn't be prepared to have oxygen in the first and the third level of the system, because many people have problems to access to the oxygen here. I think that the COVID force and many advisors that every week talk with the president. At the beginning, like Trump, at the beginning, my president, the first, because something that, especially in Peru, that is that we have a big political crisis. We had 3 presidents this year. Can you imagine it in a pandemic? The president all time show information in conference each week, but then he abandoned it because the situation was more and more critical, until now that we have a transition government that is trying to organize the strategies, because we are in a coronavirus second wave. We can say it because we are very worried about what happened in the first 8 months, and now in December, we know that we have to face it in the next 2 months.
Well, as you know, the rates in the United States are climbing. Yesterday, we hit the grim milestone of 300,000 deaths, but we also yesterday had our first vaccines given out. And I was wondering, are vaccines reaching your countries?
They are slowly. Right now, not for everyone. I think the first round of vaccines that Mexico is going to use signed a contract with Pfizer, and they are going to focus primarily on the medical care people, the doctors and everyone who's working for, to keep us safe. And it's not going to be right away in every part of the country. It's going to start in Mexico City and I think Coahuila. I'm not sure if Estrella remembers that, but yes, Coahuila. We were hoping that the vaccine can reach everyone, at the same rate and level, but we'll have to see, because Mexico has, the Mexican healthcare system is also falling apart. It was falling apart before the pandemic, and then the pandemic came, and every crack that was there, it showed.
Okay, so I just want to take a second. If you have a question, because some people are, please put them in the Q&A box. Don't put them in the chat box. And I will read the questions we can ask. So what does it mean when you say your healthcare system is falling apart?
Because it is.
But what does that mean?
Well, now it's falling apart because we have also a second wave of the pandemic, and hospitals are full again. And this one's even worse than the first one, especially in not all over the country, but in many states, and especially in Mexico City, where we have the biggest population. It's falling apart because before it wasn't very good to begin with, but together with the pandemic, there were a lot of budget cuts, and before the pandemic, in the health system. And the new government tried to switch, from some part of the system that was for, tending to people without social security or health insurance. And so they wanted to change it to another system, but they did it, before they were ready for that. So there's a lot of people now that doesn't have many opportunities. I mean, if you have COVID, you are admitted in a hospital, provided there's a bed for you and enough health care people. And the problem now is that we don't have enough health workers to tend to all the people that's ill, that's going into the hospitals right now. This morning, I was just talking with a friend of mine. She works for the Social Security health system. And she told me, we have beds, but we don't have people to care for the patients. So, and I mean, it's reasonable to assume this is going to get worse and worse through the next 20 days or so. The vaccines are supposed to start, the vaccination process around December 22 or something. Mm-hmm. And the government says that by the end of the first trimester of next year, everybody's going to be vaccinated. But I don't see that happening, really.
Well, they say that here. I mean, our newly elected president, Joseph Biden, said that he wants 100 million doses in 100 days. And most people think that's a dream because,
probably.
So, so someone asked a question. Have Mexico, Peru, and other countries in the region decided or determined upon the vaccine they wish to or can use, and what is the means of obtaining the vaccine? Are you part of COVAX?
Peru is part of COVAX. I think okay. Mexico too. But I would like to mention that in general, Latin America is unprepared for the vaccine process, because our governments negotiate, but the problem is all the process, the storage, the distribution, and of course it will probably take longer than the coming year of immunity. For example, I read in The Economist this weekend that my country will have the vaccines not the next year. It will be a reality in 2022. Why? Because we have a part of doses from Pfizer, and we have 3 clinical trials here, but the negotiations were abandoned in the month of the crisis, the political crisis that were in October and November. And this is a factor. But the other one is the old system, how we will manage this historical process. And of course, the doses and the decisions and the priorities. Peru is not a priority for many companies, but we are trying now. The public discussion is how we will manage this, because we have in next year in the summer we have elections. The promise was we will have 1 million doses to vaccine the doctors, nurses, and the people who will participating in the elections in the balloons. It will not be possible if we go like now. It's very difficult now to complete other negotiations, but this is a situation until today, that we don't have more possibilities to have doses, 20 millions of doses in March 2021.
Okay. So I had written that journalists covering COVID-19 in Latin America face skepticism from their governments and the public, and have actually died covering the pandemic. About 127 journalists have died in 31 countries throughout the world from COVID-19, according to the Geneva-based Press Emblem campaign. Latin America is the most affected, with at least 62 journalists who have died from the virus, compared with Europe's 23 victims, Asia's 17, North America's 13, and Africa 12. And of all the Latin American countries in the study, Peru has had the highest number of journalists who have died from the virus. 20 have died in the past 2.5 months. 6 of the journalists died in Inquitos, I'm not sure if I'm pronouncing it, which is an indigenous region in the northern Amazon region of Peru that saw one of the biggest outbreaks. So why is it so dangerous to be covering COVID-19 in Latin America?
I think the thing here is that it's not just dangerous to cover COVID in Latin America. Being a journalist in Latin America is like, you're like offering your life, depending on the kind of journalism that you do, but you're offering your life in sacrifice pretty much. And that is because here in Latin America, it varies from region to region, but in general, we live in a context with very low rates of free speech freedoms. And a lot of journalists don't have the backup from their media outlets or their newspapers, or, a lot of us are freelancers, or they are hired without medical insurance. And the pandemic also came to show all the, failures in the system. Right now, when the pandemic started, because of the way journalism is done, at least here in Mexico, it's a business that is no longer working. So a lot of people got laid off. And the people who didn't get laid off, they continue working with low pay rates. Their salaries were reduced. And there is a culture, not so much in Mexico City, but mostly in the outskirts of Mexico City, in other states, a culture where you have to do it if you want to work. And you can't refuse, and you can't say no, and you can't defend your own rights as a person, as a journalist, to your editor. So your editor is not going to have your back. He wants the story, he wants the article, and he doesn't care about you. So I don't want to generalize, because there are a lot of great editors in Latin America, but it's a situation that has been getting worse, and the pandemic just showed everything, and everything exploded.
Well, I'm sure you've you've seen the United States, where we had a president who said the virus was a hoax, that that did not encourage people to wear masks, and made fun of people who wore masks in the beginning for quite a long time, and still has parties in the White House not wearing masks. Is there that kind of skepticism among people about the virus?
Yeah.
Yes. I'm gonna let Estrella take this one, but yes.
Okay.
Well, I think one of the main problems with that here is a president. He's extremely popular, and he doesn't wear a mask. And he's been, underestimating the pandemic ever since the beginning. And going even against the advice of his own people. So he has this thing that every morning he gives a press briefing, and he just talks, right? Sometimes there's no preparation or enough data or nothing. So he tends to say sometimes lots of things that don't have any base, any data to support them. But he's been consistently refusing to wear a mask. And being so popular, people follow his example. They do that. And this has been terrible. And the other thing that has been terrible is that since the president is not doing that, even though the health system is trying to convince people of doing it, there hasn't been enough money put on health campaigns to do that, with the exception of Mexico City, because of the governor we have. She pays attention to that. She always wears a mask. And she's had COVID already, but the president doesn't. And he doesn't want to make any of the measures mandatory. So that's a real problem.
So so for all of you, your restaurants have been open, your public transportation has been open. You've never gone on a lockdown.
No, we did. We
did.
We got in
Okay.
lockdown, and but country has been opening up gradually. Restaurants have restrictions; they can be open, but not too late, and they cannot take more than 30% of their usual customers, and they have to follow regulations. But it's very hard, to make sure they follow them, because we don't have enough people to oversee that. And this has been, or they say it has been, but I believe that's true, a fight between our governor and the president because of that. Because we have this light thing, this like a street light system, right? Red, green, yellow, whatever. We've been in orange for a long time, when we all know we should be in red, in the highest alert. But the president opposes that because it means slowing down the economy that is going terribly. So I understand it's a very hard balance. But now the situation is really getting out of hand. It's getting very, very dangerous. We have too many people dying every day. So I don't know. I don't think the federal government is doing what it's needed. I understand that's not popular, and it's not giving an example they need to give to the people. It's hard enough for people, to lose jobs and so, but it's harder even to lose your loved ones to this thing. So I think, sometime from now, people will look back in hindsight and will agree that we've been managing this really bad. I don't know if Myriam agrees with me. But.
I would like to mention something about David said journalists, why many journalists in Peru died. When we searched some of the information about their experiences, we noticed that most of the media didn't have a strategy of coverage this situation. Not only to wear the mask, just all things, because in my country we have restrictions. The public transportation were closed for 3 or 4 months at the beginning, but journalists had to go out. And I also noticed that some journalists who died were old people, and they were people who were photojournalists or people who were reporters that needed to change their schedule for this case. And the other thing is that many people die in the Amazon regions. Why? Because in Latin America, correspondents, reporters that are not in the capital, that are in the regions, all the time don't have all the information, and also they have bad conditions to work. And that's the reason many newsrooms didn't know how to manage it. I think that this is a big responsibility for the medias, and also people, as Myriam said, that have to work. Journalists are not, as other workers, were essential. And we wanted to go to the hospital, because if you were not there, you didn't know anything, because in Peru, hospitals didn't offer information. Yes, you have a table in the conference and not more. We have to go, but for example, we plan a strategy who should, at what time, how, the equipment, and it was not the same situation for everybody. That's why many people, all people and correspondents from the regions have died for a cause for COVID.
Okay.
David, sorry.
Yes. Go ahead.
Yeah, one other thing that I want to say, and I want to relate this from a question that actually I saw, that they ask if the concept of machismo is playing a role in non-wearing masks. And I want to take this question and another comment to talk about the cultural situation here in Mexico. When it comes to journalists, it happens in Mexico. I think it happens also in a lot of parts of Latin America, because let's say mistreatment or the low work conditions have been low and have been such a hazardous problem for such a long time. Journalists, the culture of journalism has become accustomed to not saying anything and just flowing with the bad treatments. So they are just resigned. Like, I know that if I talk to my editor, I will never, get a straight answer. So I have to be creative on how to survive this. And I can't say anything, and I am so tired of defending my own rights. And I think this translates also to another cultural part of the country, and maybe the region, where people don't wear masks. I don't think it's that much because a culture of machismo that, I am really strong and I will never get, sick and whatever. It's because people are tired and people are resigned. So they know that the healthcare systems are a mess. They know that they need to work. They know that they are living day by day, not caring that much about the future, because they don't want to worry about the future with all the worries that they have to worry every day. I know that I use the word worry a lot, sorry.
That's okay. It's the number one word during a pandemic. So,
yeah.
So I had a question. So in the United States, minorities and poor people, which are often hand in hand, they've been very affected by this. So I read that an estimated 231 million people in Latin America are predicted to be living in poverty by the end of 2020, reaching a level last seen 15 years ago. Latin American countries have long had some of the most scarring income inequalities in the world, and they're predicted to worsen. Also, the informal labor market is huge, making up 54% of all work across the region and up to 70% in Peru. Informal workers have little access to social protection and have no choice but to continue to work daily to earn a living. The result is that their capability to follow quarantine and social distancing measures is limited. Informal workers also have less access to healthcare. And I'm sure that is playing a part in this in Latin America. Basically healthcare, inequality, and also multi-generational households, which I know are, common. Estrella told me that's very common in Mexico to have, people living with their children and their grandparents, and I'm sure all these factors do contribute to it. So, is there anything being done for the elderly? Are they being advised just to, be distant? Anyone?
Okay, Fabiola. Then.
Okay, now we are living a humanitarian crisis because the impact of the disease is in many lines. You mentioned who were the population who have the worst impact, and now we say we didn't have measure the pandemic impact on the indigenous community and in the regions that we couldn't cover until now. And this is something because the information and the resources from the government arrived in June, for example. In June, We have 3 months in pandemic in the cities, but in the communities, poor communities and indigenous communities, the emergency and the resources, the mask and other things to reinforce the public health services arrive in June. The other thing is that many families had to lost their employees, had to go out to the streets. One of the, my country is very very well known because of the food. No, when you say Peru, we have a custom to go every day to the market. We like fresh food to prepare, and the markets were one of the points or focus of the disease, of the transmission of the virus, and we didn't know anything. And all days people go out to try to survive because the situation, the economy, and the conditions, there was not an alternative to buy a lot of food for 1 month or 2 months and to stay at home. To stay at home was very difficult because of the inequality. And if you can measure the impact of the strategies, the sanitary strategies for the country, you have to take care for which Peru, the formal Peru or the other Peru, that is the real Peru. And this is something that we are working on it in many stories, because now we can travel. In October, the airlines all opened, and we can travel to other regions, and we can go out with our automobiles. Before September, we couldn't. We were like, you have to stay here, but the government didn't have a strategy to support the population who have employed and food and many things. That's why we say we have a humanitarian crisis now.
Have people been getting economic aid from the government?
We had some programs at the beginning, like baskets with, how can I say, like your supermarket bowl, something like this for families, but it was a corruption program. The food didn't arrive for all the families. Next, the own communities in Lima and other cities try to do like popular food by their own, like they say, ollas comunes in Spanish, to prepare their food and to sell for less than $1, and every day to support them. And the government said, okay, we will support this to formalize this. And then we have the bono. It's like a check or something similar that is less than the minimum salary for families. But we also have a corruption pandemic. And this is the problem, that we have many bad results in the strategies we took in this month.
Well, one thing in the United States, I'm sure you've heard of Dr. Fauci. Maybe not, but he's like, he gets up and talks and he tells people what to do. He's 80 years old and he's been in charge of the infectious disease of the National Institute of Health for many, many years. And people like him and they listen to, and he tells them why you should wear a mask. He tells them why the vaccines are safe. He explains things. And do you have any counterparts like that who are doctors who get up and talk and people kind of admire and listen to?
Yeah, we do, but not enough, not nearly enough.
Right.
In Mexico, we have really, really good scientists, epidemiologists, infectologists, virologists. but there are not many. That is the problem.
But do they get up and talk to the people on TV?
Yeah, they get invited a lot to interviews, and some of them have become very popular on social networks. In Twitter, for instance, there's this doctor that's all the time sharing, reliable information. But you wonder how many people checks Twitter, right? That's the problem, that the best information doesn't reach the whole of the population. It stays, in some sort of a bubble of the people that consult that. And well, we definitely have people like that. And but the other problem is that our own government doesn't care for scientists. And that's a huge thing. Because, Mexico used to make vaccines, lots of vaccines, and export vaccines. That ended with all our many economical crises. So we're not able to do more than 2 vaccines now. Well, we have people that could do them. If we had the support of the government to our scientific community from the beginning of the pandemic, we would be much better now, because we have researchers, great immunologists, people that know how to make vaccines, people that are studying the virus. There are lots of researchers involved in the pandemic, but the government is not paying attention to them. That's the problem.
So
our president doesn't believe in science. So that is terrible. And science has, just recently, the budget cuts have been brutal for science. In a moment when you need most, more money for science, more money for all these experts that can help you fight the pandemic, is being cut off brutally. And with such a poor population, more than half of our population is poor. They really poor. So the government has been giving, money to people, like in a very direct manner, not through programs, but they give people some money to young people, some money to the old people. But this is not, it doesn't have a structure that can allow you to build from there. That's a problem. And they don't want to help, small companies, small business, and they are refusing to do that. So people are in really, really big trouble now in Mexico. All these people that depend on their small businesses, or the street vendors, or all the people that's on the informal economy. I think those are the ones that are suffering the most. And of course, the ones from the layoffs.
So someone said, I read today that there's been only 100 COVID-19 deaths in all of Uruguay. What do you know? Do you know what they did that made it special? That made them special?
Actually, I wanted to talk about it to link it with the current discussion, because as we were mentioning right now in the panel, a lot of people and a lot of governments in Latin America do not believe in science and do not support science. And that has been a really big issue, particularly when you see the news and there's a lot of fake news and everything. But I think in Uruguay, not being an expert, I do not live in the region, but I have studied some of the cases. And I think what they did, for starters, the people actually believe in the dangers of the virus. And even when Uruguay didn't choose to, make obligatory the restrictions, people decided to follow them. But this also was possible because the government actually helped. So I think they created really great economic packages to help people, and they asked for, they even created a COVID fund. I think a lot of government officials reduced their salaries to create this COVID fund. And a lot of the authorities came together to fight the COVID pandemic together. So that, I think, among many other reasons, Uruguay is thriving because they do believe in the pandemic, they do believe in the virus, and they do believe in the science. And that is one thing that we really need to start pressing in Latin America. it's kind of hard when a lot of media don't believe in science journalism. So science journalists all around Latin America have been struggling to, try to make our case, and the pandemic was like the best case scenario for us, to show to people that we are necessary. If Will Monterosa was here, he would tell you. So he's one of the very few science journalists in El Salvador. In the need of science journalism, he actually started his own science news site.
I know, he said he was going to send some videos, but unfortunately his mother had an emergency.
There's something else about Uruguay that's very important. They decided to go for a testing people, and they developed their own tests. Mm-hmm. Something that didn't happen in Mexico. We do very, very little testing in the country. And they started doing testing very early on. And I think that was crucial, for them to have a real good control of the pandemic. I don't know, maybe Fabiola knows more about this.
What type of test? For example, in my country, we bought a lot of serologic tests. This kind of test didn't work at the beginning because of the quality, but also we did a less molecular test than the serologic, and this strategy didn't work as the government planned. And in Uruguay, of course, is a small country than Mexico and Peru, but they have a strategy to use molecular tests, not the serological. And this is very important, why they decided to invest the money in a type of test.
So someone asked a question, Cuba has a vaccine apparently. What about this vaccine, including a intranasal vaccine that you take through the nose? Okay, and the clinical trials began in August. Are any Latin American countries going to be taking vaccines from Cuba? And also, do you believe their data?
That's news for me. Total. I didn't know anything about that.
Okay.
Yeah, we don't have information from that, but we have information about the Russian vaccine because of some, in the negotiations, some of the commissions, members of the commission mentioned that if it's an opportunity, they will buy it. But it's an informal declaration. It's not in the formal decisions that the minister announced in the Congress.
Well, Vladimir Putin says it's the best vaccine in the world. Who knows? He actually gave it on TV to his daughter. Not him, but he gave it to his daughter.
Oh, yeah.
But it never went through a phase 3 trial. So they're really doing a phase 3 trial on they're starting to vaccinate their population. All right, so Estrella, you mentioned that the Christmas holiday season is coming. So are people being, so does the president advise people to be socially distant or to be careful?
Yeah, he advised that. He says, I think he's getting scared now because things are getting really, really bad. So he asked people to please stay home for at least 10 days.
Okay. I mentioned at the beginning that we are in a coronavirus second wave in my country, and we are worried. And the message of the government is, we are in Christmas. Please don't visit your family now, and don't go to the supermarket and buy your gift as every year. But people now is like in confusion situation because they were like 8 months in many restrictions, ways of life, and now in October the government opened many activities. The bars, for example, last month were opened, and the restaurants, other activities as to fly by airplane. Now they are evaluating if we have to go out to visit our families. The message, because we have publicity in the TV to say it's better to say to have a Zoom meeting or something like this. We're very worried because now we have more cases and we don't have enough. Now we have beds. You see, beds and oxygen, but we know that we are not prepared. The system will not support another crisis like in May and June. That's why the message is like alert in my country.
Okay. So, so what do you do to be careful? I mean, are you staying home? Are you working from home? Are you staying home more?
Yeah. As you see, this is my office, but this is my home. I am at home. I have to build my office here because I decided not to return to my office until July 2021. Why? Because we planned this year that the vaccine will not arrive this year. And the other thing is that I tried not to go out all the time. I am the director and I go out to do some things in my work, but I extremely careful with my visits. And for example, I go out to the manifestations in my country because of the political crisis, and I prepare a special coverage if you go out and you want to go out with many people around because you are going to manifestate or participate in something that is in group, please take care and wear a mask, try to take the distance and other things. We have a rule. I think that Mexico is not didn't include this, but we have to use like a face protector, and it's you should or must go with it when you go in the public transportation or in a taxi, for example, and you have to go out to the street with this. We say this measure because I support the manifestations in my media, and I have to take care if you go out how to take care, because you want to. It's your option to express your opinion on the street, but you have to take care, and we review American coverage with the recommendation of other epidemiologists when you have many activities like this. And in other countries also, because Latin America this year have a lot of crises. Many countries have this, and you have to survive with this reality and the pandemic.
So we know that there's a lot of challenges to journalism, but what are there stories that you've done that you think have helped people? Are you proud of some of the stories you've worked on?
Yes, I actually just wrote my first piece for the Open Notebook was a story about how COVID is affecting journalists all over Latin America. And one thing that I like about the Open Notebook is actually that they give advice. They don't concentrate only on reporting about a problem, but they try to give resources all the time. That's the main point. And I try to give as many resources as I could. I know that I won't be able to solve the crisis for every Latin American journalist, but I think that we can try. A lot of us have been learning, and not just journalists, a lot of people, the whole world has had a crash course on how to translate your life into digital. Okay. So we are trying to get better at it, and journalists are trying, to create strategies to do our jobs online. Not that is not an option for all of us. But as I was hearing Fabiola say all the measures that she's taking, a lot of international journalist committees have actually implemented guidelines for journalists who have to go outside so they can be better protected. So how to clean your equipment, how to maintain your distance, which mask do you have to use, how to interview people. And a lot of those elements are in the piece that I wrote. So if you want to check it out, I think that's going to be really helpful if you're going outside.
So can you explain to the audience what the Open Notebook is?
Oh, sure. Yes, the Open Notebook is an outlet, a digital outlet that writes stories in English and then translates some of them to Spanish. And they give resources for science journalists. So it's like the encyclopedia for science journalism is the Open Notebook. You will find a lot of resources, from everything that has to be that has to do with science journalism. And that was the recent piece that I wrote for them.
I want to say about being proud. I am very proud of the team, of our team, the people that make the magazine, because we've been covering all sorts of things related to the pandemic, working from home. Everybody, we have stories on whether it's a good idea to close the borders or not. Very early on, we started talking about the coronavirus and what is it and where it comes from. We've been covering epidemics for a long time. And that's a topic that we care a lot about. So it was not surprising for me to see a pandemic, because we knew from our contributors for a long time that this was a real possibility. Not exactly which one, but we knew that because we covered several, like Ebola and Zika and dengue and the flu in 2009 and all that. So we've been consistently covering with science journalists, also with researchers, and we work with them a lot in the way that the Conversation does, this website, journalists together with scientists. And what we try to do is to explain our audience what's going on, what's really going on, how do we know what we know? How do we know what virus is it, how it works, how it takes on your body, how it's being transmitted, and all that. And we've been doing that on long form, on infographics and columns, and as much as we can. We're not many people, and as you know, David, we're now almost half of the people we used to be since this month. There's been a big cut. Layoffs, but people have been really trying their best in this very difficult situation, because it's you can feel it. It's not only that it's hard to go places and it's dangerous to go places, but it's how people feel, and we covered that too. How do you feel? This is something really stressful. People are fearful, they are afraid, and how do you deal with that too? And one of the most important things for us has been to talk to young people in a way that they can have hope, reasonable hope, evidence-based hope, if you may. Because young people now are really, really having a very hard time, harder than adults. They cannot go out. In Mexico, schools are closed since March, and universities are closed. So they're at home. All these young people, one of my sons, for instance, was ready to do his final dissertation. And he's a film student, so he couldn't shoot his movie because he was about to do it when the pandemic started. And that's the situation for a lot of young people that cannot finish up their studies or cannot go find jobs. So it's very stressful. And we really try to tell them, it's going to take time, but there's a solution. There are vaccines. We told you there were going to be vaccines, and now we start having vaccines. And we also want them to see that scientists are doing their job, that they're trying really hard in Mexico and elsewhere to find answers, and that you can find answers through science. So that's mainly our point with them. And of course, explaining them why they shouldn't go out at night or go to bars or that kind of thing, right? But to keep them hopeful. and to make them feel they can make a difference if they are careful, if they, because many of them have grandparents or old uncles and aunts, and so they need to really realize this is a real thing and it's very dangerous. And even though maybe they won't get a bad case of COVID, they can kill their relatives. So we work a lot on that too.
So basically the message is, if you go out and have any fun, you're going to kill grandma. So.
Yeah, that's the message, because it's real and it's happening.
I know.
And it's so. I just read today a news story. I think it was in the US. I'm not so sure. About people from residence for old people that went to a wedding, and six people died at the residence as a consequence.
Yes,
it's very real. So we need to tell them these stories. We try, to make them connect with this reality and with the fact that we're going to get out eventually, probably.
I mean, I've been having Zoom meetings with my children. Also, I mean, I think one of the harder things for people is that we had the pandemic in the spring and the summer, and you could go outside. But now it's getting colder. We're going to get a big snowstorm. The flu is coming. And we predict there'll be less of a flu season because people will, they had very, very little flu in South America and Australia and all that, because people did wear masks and people were socially distant. So that's one good bonus from this, that people are waking up to this. I just wanted to ask that one of our guests had a medical emergency with his mother, and he's the one that you mentioned, William, that he has videos. He's emailed our videos, and we're going to upload them to the SWINY website, so you can see them tomorrow, as soon as we finish uploading them. You can also see we have a YouTube channel, and this will be on YouTube, and I will email copies to all of you so you can spread them to your families, colleagues, and friends. So I want to thank all of you for spending some time with me. I really appreciated it. We did it with European journalists. It's great to be able to do it with journalists from Latin America. We learned a lot about what's going on in your countries, and also what's the challenges are of being a journalist, and also trying to tell a story in the middle of a pandemic. So we do appreciate it. This is going to be our last broadcast for 2020. We're going to take a little break because next week is Christmas and the following week is New Year's. So I hope everyone will stay safe. It's a time to reflect and not to, I know everyone wants to go to a party and get together with their family, but this is not the year to do it. And so hopefully, I really appreciate it, and stay safe, everyone, and we will resume again in January. So I want to thank Estrella, Fabiola, and Myriam for spending some time with me. And I wish I could conduct this in Spanish, but my Spanish is like stage 0. So anyway, it was great getting to, I mean, I know I've known Estrella a long time. It was great getting, I was communicating with several of you, but it's great to actually see you on the screen. And I'm glad that you're all positive, and that hopefully one day we can all meet in person, which would be nice. So I'm going to wish everybody good night. Please stay safe and wear masks, be socially distant, and you can have a happy holiday being socially distant and wearing a mask. So take care, and we'll see you soon.
Thank you, David.
Okay, you
too,
Joe.
Thank you.
A real pleasure. Thank you.
Thank you.